This 15-minute video is a presentation of the Injury and Illness Prevention Program. The reason for this video is to introduce the program and provide information about the program. The IIPP is a general health and safety program that covers all employees and provides the framework for DTSC's health and safety program. The most valuable of resources at DTSC are the people who staff this department, and it is with that understanding DTSC recognizes that workplace incidents can cause an enormous amount of physical, financial, and emotional hardship for individual workers and their families, making the IIPP a necessary and important component to have in place. An IIPP is a set of universal practices integrated into DTSC's health and safety program. These same practices are utilized throughout the United States by employers to effectively manage health and safety in their places of business. The main goal of any injury and illness prevention program is to prevent workplace injuries, illnesses, and deaths, as well as the suffering these events can cause workers and the financial hardship they can also cause both workers and employers. Title 8 of the California Code of Regulations 3203 states all California employers will have an effective injury and illness program, and for those employers who employ more than 10 employees, that program must be in writing. At DTSC, the program can be found on the Health and Safety SharePoint site. Along with this program are other health and safety policies, procedures, fact sheets, and program details. Additional information regarding the program can be found on the Cal-OSHA website at www.dir.ca.gov. Within DTSC's strategic plan, there is a section on DTSC values. These include leadership, respect, teamwork, innovation, and commitment. The California Code of Regulations lists 8 specific elements that an effective injury and illness program, or IIPP, will have. We will be discussing the following sections: roles and responsibility, compliance, communication, hazard assessment, investigation of injury or illness, hazard correction, training, and record keeping. Most successful injury and illness prevention programs include a similar set of common sense elements that focus on finding all hazards in the workplace and developing a plan for preventing and controlling those hazards. Management leadership and active worker participation are essential to ensuring that all hazards are identified and addressed. Finally, workers need to be trained about how the program works, and the program needs to be periodically evaluated to determine whether improvements need to be made. These basic elements: management leadership, worker participation, hazard identification and assessment, hazard prevention and control, education and training, and program evaluation and improvement. These elements are common to almost all existing health and safety management programs. Each component is important in ensuring the success of the overall program, and these elements are interrelated and interdependent. Roles and responsibilities. DTSC's director has approved the policy and is also accountable for the effective implementation of the Injury and Illness Prevention Program and is responsible for the overall management and administration of the program. The executive staff are responsible for providing constant input concerning the needs of all DTSC employees by providing adequate resources to ensure the health and safety of DTSC staff. Executive staff members are responsible for ensuring that employees under their supervision comply with the regulations of the program. Roles and responsibilities. All managers and supervisors are responsible for implementing the IIPP in their work area, enforcing DTSC policies and procedures, and ensuring that proper health and safety procedures are being addressed by all employees. This includes reporting injuries and illnesses to the Return to Work Coordinator or Regional Industrial Hygienist within 30 minutes of the incident. DTSC uses various communication systems to relay information to all employees on matters relating to occupational safety and health. They include the Health and Safety Training Program, publications, meetings, anonymous and confidential hazard reporting, and an anti-reprisal policy. Training. The Health and Safety Training Program is an integral component of the communication system. The training program is described in the employee training section, covered later in this module. SharePoint. As mentioned earlier, the IIPP and other health and safety publications are available on the Health and Safety Program SharePoint site. Health and Safety Committee. The committee members were selected to represent all aspects of DTSC. The committee will meet every quarter to discuss health and safety concerns, injuries, illnesses, and near misses. Anonymous hazard reporting. To report a hazard or share a health and safety concern, employees may discuss the issues with their supervisor, with any industrial hygienist, or submit a concern via the regional office advocate suggestion box. Hazard reporting may be done anonymously or confidentially. Employees shall not be discharged or discriminated against in any manner for reporting of health and safety hazards to DTSC or to appropriate governmental agencies. Supervisors shall inform employees of this policy and encourage reporting of workplace hazards to management. Procedures for identifying and evaluating workplace hazards include scheduled periodic inspections. DTSC encourages all employees to report, without fear of reprisal, any workplace hazard they identify. It is the intent of DTSC through the IIPP to identify and evaluate unsafe work conditions and practices so that injuries and job-related illnesses are reduced, if not completely eliminated. Periodic inspections are the principal method that helps to reduce accidents in the workplace. At DTSC facilities, inspections will be scheduled every 6 months and conducted in conjunction with the Health and Safety Program and the Regional Administrative Manager. Unsafe conditions identified during these inspections will be prioritized and corrected in order of severity. Procedure to investigate occupational injury or occupational illness. DTSC's accident or near-miss procedures have been established to ensure that accidents and near-miss events are properly reported and analyzed. An accident is defined as an undesired event that results in personal injury or property damage. A near miss is defined as an incident where no property was damaged and no personal injury was sustained. But had there been a slight shift in time or position, damage or injury could have easily occurred. The investigation and analysis of accidents and near-miss events can prevent future accidents, reduce the number of accidents, and reduce the severity of accidents. The goal of investigating accidents is to identify the root cause of the accident or near-miss event rather than find fault or place blame on an individual. All accidents with personal injury, all accidents resulting in property damage, even if no injury occurred, and all near-miss events must be reported. This includes all incidents occurring in the office environment during DTSC field activities and by work performed by private contractors on sites under oversight of or contract with DTSC. The size and makeup of the investigation team shall be determined by the accident type and complexity. Accidents and near-miss investigations shall be led by industrial hygiene staff trained in accident investigation techniques. A summary of all accident and near-miss reports shall be posted on DTSC's Accident and Near-Miss Reporting SharePoint page. The posting shall include a summary of the accident as well as corrective actions and recommendations from the accident investigation team. All personal identifying information shall be removed from the posting to protect confidentiality. Only the details of the incident will be posted. Methods and/or procedures for correcting unsafe or unhealthy conditions, work practices, and procedures. The intent of DTSC is to minimize or eliminate all hazards, unsafe work practices, and unsafe or unhealthy working conditions, and to correct them in a timely manner. When an imminent hazard exists which cannot be immediately corrected without endangering employees and/or property, the following steps will be followed. Remove all potentially threatened employees, provide necessary safeguards to employees responsible for correcting the conditions, correct the problem. Hazards will be eliminated or minimized first through engineering controls. If engineering controls are impractical or infeasible, administrative controls will be used. When engineering controls alone or in combination with administrative controls cannot adequately minimize the hazard, personal protective equipment will be provided. Lastly, the corrective action and date corrected will be documented. As a minimum requirement, each DTSC employee must know and understand the following: the provisions of the DTSC IIPP. No employee is expected to undertake a job until he or she has received instruction on how to do it properly and has been authorized to perform that job. No employee should undertake a task that appears to be unsafe. Each employee is expected to immediately report all unsafe work conditions. The following records will be maintained for at least 5 years. Scheduled and unscheduled inspections. Throughout the year, the listed records will be periodically reviewed to determine where inquiries and illnesses have occurred and in what numbers. Accident investigations. Attention will be devoted to any patterns or repeated situations. Hazard evaluations, IIPP training records, Cal OSHA log of occupational work-related injuries and illnesses, Form 300. These records can help identify hazardous areas in the workplace and determine where immediate corrective action is needed. Remember, do not undertake a job until you have received proper instructions. Do not undertake a task that appears to be unsafe. Report all unsafe work conditions. Report all injuries and illnesses to the supervisor within 30 minutes of the event. A copy of the IIPP policy can be found on the Health and Safety Program's SharePoint page. Injury and illness prevention programs are based on proven managerial concepts that have been widely used in industry to bring about improvements in quality, environment, and safety and health performance. Effective injury and illness prevention programs emphasize top-level ownership of the program, participation by employees, and a find-and-fix approach to workplace hazards. To be successful, there needs to be cooperation between all levels of management and staff. This presentation was written by the Health and Safety Program. The voiceover presentation was compiled by the training unit. Finally, we would like to thank all of you for taking the time to view this video. Should you have any further questions, please contact your Health and Safety Program representative. Thank you and have a safe day.